So Tom is actually here now. I just saw him. We didn't think you were coming, so we were going to have a discussion until noon. But thank you for being here, and we'll make sure that we have time for you before noon, okay? And Ivory's putting up poll everywhere, so we definitely want all the questions from the room. Keep using your poll everywhere. And for folks on the webcast, please enter for poll everywhere. So maybe another 10 minutes. Thank you.
So as we're waiting for questions to come in, what was the hardest challenge that you encountered as you were thinking about this and doing the work on this report?
I think one of the challenges is, as you look at the evidence around health inequity, is that you then look at all of the social determinants of health, and it's a vast literature. And what was liberating is, as we looked at the community examples, is that you could start anywhere and start making inroads in any of those areas: economic development, housing, transportation, food access, and you would be making measurable improvements towards health equity. And so that was sort of both the challenge and the relief.
Yeah, I was gonna say essentially the same thing, that I think partly because we don't have the evidence base that as perhaps precisely as we do in some other areas of medicine and health, it was oftentimes difficult to figure out how do you pull all this together. I think one of the things that was really a great anchor was that this was focused on community efforts, and we had to keep coming back because it would be very easy to be incredibly diffuse. But I think we kept coming back to the issue that this was really around how do we think about this at the community level? What is it that we need to do to support communities in the effort to address this issue of health inequity? And I think that ended up being a very good grounding, being able to look at these incredible examples, the 9 examples, and it's wonderful to have people who are here from that, I think was very grounding in a lot of ways. But, to the point that we made several times, the importance of having more research in this area, I think this is one of the things that was very clear, is that we don't have the kind of evidence base that we need to really be as impactful overall.
Yes. Good morning. Thank you for your contributions. My name is Jennifer White. I'm with the American Heart Association, Voices for Healthy Kids. Again, I appreciate this report as well as your contributions to it. I had a question about policy and wanted to know about, and really I think that we do have a lot of great policies on the books. Unfortunately, we recognize that many of those policies are not being implemented equitably across our communities. And so with that, as an organization and as an initiative, we're focusing on making sure that we have equitable language within the policies in which that we work on and advocate for on a state and local level. But from your perspectives, what are those key accountability mechanisms in making sure that the implementers in those respective communities are making sure that there are equitable outcomes in knowing that we have great policies but are not being implemented, but what are some of those key mechanisms that will be key in making sure that we see equitable outcomes from those policies?
I think it's a really an outstanding question, and I think we can be opportunistic. If we take, for example, the new federal legislation around the education law, for example, it puts in place requirements that schools do community needs assessments and that they show evidence-based improvement plans. For a community to take that, of course, they can work now with technical assistance and support from hospitals, particularly nonprofits that are doing something similar on the health side. So we get some energy there, and we have a win-win. The idea that now can we focus on not just health at the average, but the distribution of health, that is part of, I believe, this sort of culture of health thinking that needs to happen. It does need to be grounded in a shared vision and value around health equity. I don't think that that's easy to mandate through policies. That said, there have been states that have put in provisions that say, when you do your assessments, make sure you're looking at the distribution of both the benefits and the burdens of any changes that you're making. So I think we can teach that, set that frame of mind and how to come to that shared vision around the importance of equity?
So I see another question. What are your thoughts on the intersection of documenting disparities and inequities and reinforcing stigma?
I guess if what is meant by that is that by pointing out these inequities, we reinforce stigma, I guess, I think it depends on how it's handled. I was in South Africa at a time just post-apartheid where there was a lot of discussion ongoing about, if we want to move to a, quote, post-racial society, do we continue to break things down by race, or do we just talk about all being South African? Well, I think that I think it's difficult, and obviously we have a lot of analogies here. I think it's difficult to leap to a point where we don't talk about the differences if, in fact, those are the very differences that lead to the inequities. That said, I think the way in which we talk about those differences, the way in which we talk about those inequities, can be done in a way that doesn't have to be stigmatizing. And I think particularly if we use them in ways that shift the outcomes, then they definitely don't have to be stigmatizing. So I think a lot of it is just about how do you do it, but I don't think we can get past the fact that race, social economic status, education status, et cetera, are the contributors to these very things that we want to address.
My name is Lottie Aaron. I'm a senior fellow at the Urban Institute. I also co-direct the Robert Wood Johnson Foundation's program on policies for action, their research program in that area. I'm curious, a little bit in line about the lens on individual versus kind of more upstream levels, and yet we're also talking about the community level, so we want to kind of keep it upstream within that downstream portion of the continuum. To what extent, the study panel drew on all the work that's happening around collective impact, which is being kind of studied and done from a variety of different angles, including health promotion, obviously, but also workforce development and economic development and a lot of social justice issues. And how much learning there was from that. And as part of that lens, this idea that a progress within this sphere is really going to involve kind of setting up systems of mutual accountability among a lot of the drivers, whether they're in the healthcare system or in education, in criminal justice. There are just so many angles here, but sort of holding the leaders within the community mutually accountable for the kinds of outcomes that the community expects to see, and that really will be key to kind of advancing change.
There certainly is, there are sections in the report that address this idea of collective action, and where we've seen it in different places. And it was this idea of, I guess if I would frame it as the shared vision and values piece, was very important in our community examples. The other thing that was notable about the communities, particularly the ones we highlight, but others have this characteristics as well, is that they had a plan, they had measurable goals, and they were headed in that direction with deadlines and timeframes, right? So that they weren't, they had that momentum that may not be exactly what you mean by accountability, but they had a shared vision of, in metric-wise, of where they wanted to be.
Yeah, just to add to that, I don't, if I can remember, I don't think we specifically talked about collective impact in the sense that, a lot of people have coined that term. But I think a lot of what we talked about really was how do you build these coalitions that brought in different sectors who had, different roles to play, and building common vision, as Allison said. So I think we talked about the notion of collective impact without ever really using that specific terminology.
During the course of your report, writing your report probably, the evidence about the sort of unprecedented increase in mortality among lower income, lower educated whites came out. And, you know, I'd be curious to see whether or not you thought that is changing the dialogue. Because historically, for lots of good reasons, the focus has been on people of color in particular. But that really got a lot of attention in ways that other reports haven't. Do you think that really has changed the way we're having this conversation?
Yeah, we talked about that. And in fact, in one of the open sessions, somebody presented a lot of the data around that. And I think it's too early to say. Obviously, the opioid epidemic has, been on front pages. There's a lot of discussion around that. I think that it's probably, given our current politics and some of the groups that came out very strongly in support of the current administration, I think that there is a rising dialogue around a portion of disenfranchised populations that we haven't talked a lot about. I think it will be interesting to see. I think thus far people feel like we're still talking too much to ourselves, and that we haven't yet gotten the kind of enthusiasm around the fact that people are dying disproportionately, and we should be doing something about that beyond our own community. And so I think it's why this whole culture of health is so necessary, because I still think we're talking to ourselves, even on that issue where I think there's been, clearly a lot more attention, but I'm not sure a lot more mobilization around inequities yet.
Andy Sher, Autism Speaks. I was wondering, you talked about education as a social determinant of health. What about information or misinformation, especially these days where there seems to be...
Alternative facts?
Alternative facts, yeah. I mean, at least in the autism community, that's been a major challenge, right? Try to help people understand what is really evidence-based, what is not.
It isn't something that we addressed in our report.
We talked about real facts.
Me? Okay. Hi. I'm Vivian Gadsden from the University of Pennsylvania, and thank you so much for the report. I've read some of it, and I have great appreciation for people, for the committees that get the report out. My question really has to do with, and perhaps I just haven't read far enough into the report, the construction of communities, the concept of communities itself, and who is the community and who is not. And there is, we have a lot of data that show that some of the best programs that have gone into, let's say, low-income communities have been successful at bringing people who already want to come, or people who are on the verge of coming, right? And very often, community-based organizations, or even community groups, community activists, represent only a subset of communities. And I'm just wondering, not so much, well, in part, whether that was a part of your conversation, even if it's not written in the report, and what is your thinking about how we can strategically work with community-based organizations to think about how it reaches out to other members of the community who have historically been described as hardest to reach?
It's a fascinating set of questions. I think we talk about in the report, there are many different ways to define community, and ours was fundamentally geographic, right? Tying back to some of the recent insights around even some of the latest data on how much this varies from one community to the next. Their history is different. Their power structures are different by community. Some of the lessons we drew from the civil rights literature is that they have a framework and a process for thinking about authentic engagement and what that means, and relying on some of those principles and processes to think about how to engage the community and who to engage. The examples we give have faith community partners, business partners, health systems, housing, but to different degrees. So it is very much idiosyncratic. I think what the important thing is to, given that we have all this effort in communities, to capture what's going on and make it accessible to other communities so that we don't have to keep reinventing the wheel. There must be strains, and our belief is that there's agency in these communities, and there is evidence, and if we can put that in a place to make it more accessible, we can get some momentum around these community efforts, including things like how do we get launched.
Great. Thank you all.